Post-Operative Care, Complications and Management, a detailed review by Dr. Khalil Rahman. Post-Operative Care, Complications and Management. Introduction. Post-operative care is a crucial aspect of any surgical procedure, as it plays a significant role in ensuring a successful and complication-free recovery for patients. While modern medical advancements have significantly improved surgical outcomes, there remains a potential for complications to arise during the post-operative period. Understanding post-operative complications. Post-operative complications refer to adverse events that can occur following a surgical procedure. These complications can vary in severity, ranging from mild discomfort to life-threatening situations. A. Surgical site infections, SSI. SSI is one of the most prevalent post-operative complications. It occurs when bacteria or other pathogens infect the surgical site, leading to redness, swelling, pain, and pus formation. Prevention includes proper sterilization techniques and antibiotic prophylaxis. B. Deep vein thrombosis, DVT. DVT is the formation of blood clots in the deep veins, commonly in the legs. These clots can be dangerous if they travel to the lungs, pulmonary embolism. Prevention involves early mobilization, compression stockings, and blood-thinning medications. C. Pneumonia. Pneumonia can develop after surgery, especially in patients who have undergone chest or abdominal procedures. Breathing exercises, early ambulation, and respiratory therapies are essential in preventing and managing post-operative pneumonia. D. Wound dehiscence. Wound dehiscence is the reopening of the surgical incision, which can be due to infection, excessive strain, or poor wound healing. It requires immediate medical attention and may need wound resuturing or advanced wound care. E. Urinary tract infections, UTIs. UTIs can occur after surgeries involving the urinary system. Proper catheter care and early treatment of any UTI symptoms are essential in preventing complications. F. Adverse reactions to anesthesia. In some cases, patients may experience allergic reactions or adverse effects from anesthesia. An anesthesiologist's close monitoring and proper patient history assessment are crucial to minimize the risk. Management strategies for post-operative complications. If you are in Pakistan, then you can visit our branches for proper rehabilitation and treatment. Effective management of post-operative complications is vital to minimize their impact on patients' health and recovery. Below are some strategies that healthcare providers employ. A. Early detection and monitoring. Post-operative patients should be closely monitored for any signs of complications. B. Pain management. Adequate pain management is essential for patient comfort and to encourage mobility, which aids in preventing certain complications. C. Infection control. Stringent infection control measures, including proper hand hygiene, sterile dressing changes, and antimicrobial stewardship, help reduce the risk of cheese and other infection-related complications. D. Deep breathing and ambulation. Encouraging patients to perform deep breathing exercises and early ambulation helps prevent pneumonia and DVT by improving lung function and blood circulation. E. Nutritional support. Providing proper nutrition, including adequate protein intake, aids in wound healing and overall recovery. F. Psychological support. Addressing the emotional and psychological needs of post-operative patients can positively impact their recovery and reduce the risk of complications related to stress or anxiety. Preventing surgical site infections, SSI. Surgical site infections are a significant concern after surgery, as they can lead to prolonged hospital stays, delayed wound healing, and increased healthcare costs. To prevent cheese. A. Proper preoperative skin preparation, thoroughly cleansing the surgical site with antiseptic solutions before the incision is made helps reduce the bacterial load and potential for infection. B. Sterile technique, Ensuring that the surgical team maintains a sterile environment during the procedure minimizes the risk of introducing pathogens into the surgical site. C. Antibiotic prophylaxis. Administering appropriate antibiotics before surgery can significantly reduce the risk of SSIs in high-risk patients. D. Wound care. Keeping the surgical incision clean, dry, and properly dressed helps prevent contamination and promotes optimal wound healing. Deep vein thrombosis, DVT, prevention. Deep vein thrombosis is a critical post-operative complication, especially in patients who undergo major surgeries or have certain risk factors. Preventive measures include: A. Early ambulation. Encouraging patients to start walking and moving their legs as soon as possible after surgery improves blood circulation and reduces the risk of blood clots. B. Compression stockings. Graduated compression stockings help prevent blood pooling in the legs and lower the risk of DVT. C. Blood thinners. In some cases, anticoagulant medications may be prescribed to high-risk patients to prevent the formation of blood clots. Pneumonia management. Post-operative pneumonia can be particularly dangerous for patients recovering from chest or abdominal surgeries. A. Breathing exercises. Encouraging deep breathing exercises and the use of incentive spirometers helps maintain lung function and prevents lung complications. B. Early mobilization. Getting patients out of bed and ambulating as soon as possible aids in lung expansion and reduces the risk of atelectasis, lung collapse. C. Chest physiotherapy. In some cases, chest physiotherapy techniques are used to assist with clearing mucus and improving lung ventilation. Wound dehiscence and proper wound care. Wound dehiscence, where the surgical incision reopens, is a serious complication that requires immediate attention. A. Strict wound care. Properly dressing and caring for the surgical site, along with following surgeon instructions, are essential for wound healing. B. Avoiding excessive strain. Patients must avoid activities that put undue pressure on the surgical site during the healing process. Managing urinary tract infections, UTIs. Post-operative UTIs can occur, particularly in patients with indwelling urinary catheters. To manage and prevent UTIs. A. Early catheter removal. Whenever possible, catheters should be removed as soon as they are no longer needed to reduce the risk of infection. At the end, it is requested to you to please subscribe our channel to support our content.